Well, hugs it indeed will be then. Hello, dear friends. Once again, we
welcome you to our channel. Hugs.
So everything as it should be. Good day. So our patient has arrived. Her name is Sophia. This is an important detail, as the patient herself pointed out. Sophia.
If I tell the whole story about what brought me here, let's start from the bottom, namely the lumbar region of the spine. I noticed that the situation there isn't the best. At 23, I started having occasional pinched nerves, and it's really unpleasant when you sometimes can't even get out of bed, or in general, it just creates an uncomfortable feeling. Also, my right shoulder and at the same time my left shoulder joint, which have been bothering me for about 16 to 17 years. No one has been able to do anything about it, which is really unfortunate. In this regard, I've probably seen every doctor possible, but the pain still remains. So I just try to live with it somehow.
By the way, where else would you see this? I think only in Russia can you see someone smiling while talking about their back pain and no one is able to help them. What exactly should they do in this particular situation to make the entire process much easier and more straightforward?
So what did I do? Back when I was about 16 or 17, I was really into fitness and worked out a lot at the gym. I used to work hard at the gym, but now I've stopped because once I got to university after one exam session, it all just became too much. And for about the past year or year and a half, I've been swimming regularly. At first it was just short distances because we were just learning and could not really swim at all. Now we've worked up to 2 to 3 kilometers. Along with that, I've also been getting regular massages for about a year or two now. I go once or twice a week. And as odd as it may sound, I always ask them to really work me over hard during the massage. There's an immediate sense of relief in that moment.
Is it long-lasting, probably? Well,
it lasts a day. Its duration varies with activity, sometimes lasting longer, sometimes discomfort returns.
I remember correctly, but football is actually at the top per capita, per person. No, football is
still traumatic. I mean, it's at the top.
It remains, but in a different sense. In terms of injuries, yes, but swimming is actually much less traumatic. Well, listen, in terms of injuries, yes, but swimming is much less traumatic. Well, listen, for example, let's say I have relatives, I would have gladly gone swimming, but he often gets ear infections or something else, one thing or another. So apparently water just isn't for him. You can't please everyone. Swimming in general. How exactly do you truly know when you've actually swum a sufficient amount? Is it based on time, distance, or meters?
It's all of that together, meaning it's a certain part of it. I train hard, often feeling muscle fatigue. I know I've swum enough when I hit session benchmarks, typically a kilometer for warm-up, then another for the main set. Or I frequently swim for a considerable distance, so, well, it's always quite different. After all, you simply can't do the exact same workout every single time. Distance and speed, plus sometimes you add 50 or 100 meters to swim for time. Sometimes with fins, sometimes without. With participation, it's all done that way. I don't know. The most I've ever swum was probably a kilometer in Sochi on an air mattress. Well, the main stroke is freestyle, if that's important, though it doesn't really matter in all of this. Because we don't know how to do breaststroke, I realized that this is about...
Just because you can swim doesn't mean you won't sink. Every sport you try has a specific technique, and this is no different. Your head should not lift out of the water. If it does, you create neck and shoulder tension, worsening your musculoskeletal condition. If you don't know how to swim like that, then I recommend swimming. And
some people swim on their backs in such a way that honestly it's sad to watch.
Well, what exactly can you possibly do about that? Have you by any chance had any significant injuries recently?
Thank you, but no.
So you know your height?
1 meter 65, 66, something like that.
Alright, we'll check. Okay, basically we're ready to proceed. So, as I said, you know your height, 1 meter 65, 66, something like that. Alright, good. Basically, we're already ready to proceed with the examination. If you want to make an appointment, please call the number on the screen or go to the website and book an appointment yourself, whichever is more convenient for you. Well, Well, dear viewers, we're ready to move on to our laser diagnostics examination. We position the device along the shoulders, the clavicle, the ribs, the shoulder blades, the upper and lower corners, in general, as thoroughly as possible, and also across the chest. So if you want to watch the full version, you can scan the QR code because YouTube won't allow it. I've already mentioned this. So, see you there. Now, we're ready to move on to manual therapy. We're going to do shockwave therapy. After shockwave therapy, massage isn't really that necessary anymore. So
Or here, oh my goodness, so you like it when...
your joints crack?
Actually, usually it's done a bit more gently.
Well, you like it this way. Rougher perhaps, or even a bit more rugged? Yeah, definitely. Or not, I suppose. Lower your shoulder gently. Please move a little bit closer to Anton. Then gently turn your entire torso, please.
Other alternative.
Please come closer to me now. I need you to move a little bit nearer, right here by my side. That's it, just a bit more. And then, when you're comfortable, please sit down gently. Make yourself comfortable right here with me. Hands behind your head. Alright, carefully. Lie flat on your stomach, gently put your chin down, your arms relaxed along your sides, and then slowly scatter. A small something was on your lower back. Sophia, we're ready. Patients are very good at relaxing, they know how to do it, so I don't pull too hard. This is basically enough. Of course,
when you're getting a massage and it hurts and they say relax the muscle, why are you tensing up?
you have to admit, when the muscle is tense, it's actually the patient who is tensing up, and if you work like that, it hurts more, basically.
Overall, yes, but it tenses up automatically, it contracts. In general,
Yes, but no. However, actually.
here you have to build up
Tension, so your entire body can fully relax and release any built-up stress. Now carefully and slowly turn over onto your stomach, making sure to get comfortably up on your elbows. Bring your elbows together, keep your hair neatly together, and let's proceed with the next step. Look straight forward, allow your body to completely relax, let your arms gently fall down by your sides, and then slowly lie completely flat on your back. We are now going to conduct a very quick and efficient express test for you to assess your current state. Hip joint. Your primary and most crucial task is to completely and utterly relax, to consciously and deliberately let the entire weight of your leg go, allowing it to become heavy and surrender fully to gravity. There is absolutely nothing supporting it here, so in this specific scenario, we have introduced a sturdy block. You might be wondering, why am I not actively working on this particular leg right now? The simple and straightforward reason is that I possess a second leg, and it is equally important and beneficial for me to dedicate time and effort to work on that second one as well, ensuring a balanced and comprehensive approach to this exercise. So where is it? Relax.
oh, that really hurts. That's precisely what I truly want to get rid of. Oh, damn it. And now, what's next?
Oh, my neck started to really hurt. Let me carefully put it back. Okay, please lower your leg. That's absolutely it. Did you hear anything at all?
Oh, damn. Just relax.
It's your leg now, and you can truly compare how it was before and how it is now. What exactly changed? Right now I have pulled. What has happened to you, my friend?
It really felt like, I don't know, like some kind of something in the actual joint area.
Something shifted a little, and then I'll explain to our viewers. In general, there was a block, we removed the block, and now there's movement in the joint. That's a normal thing. It's bad when there isn't any. For example, here. So what I wanted to say, hi, that's it for today, we're done. Share your impressions. Honestly, it's a very unusual thing. Probably the first time I've experienced something like this.
I've seen, because usually I thought that this wave thing would just be some kind of hitting device, especially since, you know, on Ozon, on eBay, they're sold and they just press in. But in the end, here there are these internal impulses that, well, I'll say it again. For me,
It's electricity and internal push.
well, things like that aren't sold on Ozone. Well, not like this, yeah, but at first I thought
That it would look completely different, let's say.
that's how it feels.
All of this brings such relaxation and pleasure.
A relief for the body. So, are you happy? What do I have? Anyway.
You're pumped for today. High five. Thank you for watching the video till the end. Be sure to subscribe. We also have
Other platforms as well.
so check them out. See you next time. Bye bye everyone.